I come in?
Yeah.
Great. Hi, my name is Haley. I'm going to be your nurse practitioner today. I'm just going to wash my hands, get my gloves on, but while I'm doing that, can I have you tell me your name and date of birth?
Kensington Jet, 11/12/88.
Okay, great. Are you coming in today for any concerns, or is this just a normal checkup?
That's my normal checkup.
Okay, perfect. Alrighty. I am going to start out by checking your skull here in your scalp, seeing if there's any tenderness or any issues. Are you in pain with that? Okay, I'm going to check your frontal sinuses. Any pain? Great. I'm going to go ahead and palpate your lymph nodes. Checking for any pain. Any pain with any blood. Okay. I'm going to go ahead and step behind you and assess your thyroid gland. Can you swallow for me? Perfect. Any pain with that either? We're going to go ahead and test your visual fields. I am going to have you cover one of your eyes, and I'm going to cover my same eye, and I'm going to have you tell me what numbers I am holding out, okay?
2, 1, 3,
Great. We're going to cover your other eye.
2, 1, 2.
Yes. Good job. All right. So keeping that in your hand, I'm just going to do it for a second. I am also going to go get my pen light right here, and I'm going to have you just follow this right now. So first we're going to start out with just following it with both eyes. Great. I'm going to have you use that and cover one. Follow again. Great. Cover the other eye. Great. Okay. So now we can set this aside for a second. I'm going to have you follow this just with your eyes. I'm going to move in different directions now. Good job. All right. Let's see. And I see you wear glasses. Do you wear contacts as well?
Yes.
Okay. Thank you for taking those off. I am just going to go ahead and check your eyelids. Go ahead and try to close them. Great job. All right. I'm going to have you give me a big smile. Show me your teeth. Awesome. All right. I'm going to go ahead and check your pupils. Make sure they're reactive. And they are. Awesome. All right. I'm going to go ahead and get this out right here. And I'm going to check your eyes again. Looking at your conjunctiva, your cornea. I'm going to go ahead and pull down your eyelid. Alright. Sorry, I didn't mean to hit your lip. Look again. Perfect. Alright. And now we're going to test your hearing. So I'm going to have you cover one of your ears, whichever one you'd like to start with. And I'm going to stand away from you and have you repeat the number I'm saying. 2. Cover the other ear. 21. Good job. Alright, now we're going to do the mind test. I'm going to place this by your mastoid bone, and you're going to tell me when you can stop hearing it.
No.
Okay. And now let me know when you stop hearing.
No.
Same on this side.
No.
Okay.
No.
Okay. Now we're going to do the Weber test. Is this equal on both sides?
Yes.
Okay. Tell me when you can stop hearing it.
No.
All right, I'm going to inspect your nose. Have you had any major drainage or anything, bleeding?
No.
Okay, great. All right, I'm going to go ahead and look at your lips, look at your mouth, make sure there's no bleeding. I'm going to have you actually make this light again. I'm going to have you open your mouth and look at your gums, your teeth. I'm going to have you put your tongue out, say ah. Great. Any sore throat or anything like that?
No.
Okay. I'm going to have you stick your tongue back out and move it side to side. Great. All right. Let's see. I am going to have you bite down for me. I'm going to just feel your muscles, your cheeks here. Any pain? Okay. Great. Let's see. And now I am going to have you close your eyes. I'm going to either place an item that feels a little sharp or a little dull on your skin, and you tell me which it is, okay?
Okay. Sharp. Dull. Sharp. Sharp. Dull.
your face, just push back and try to give me resistance. Great. Awesome. All right, so now I'm gonna go ahead and inspect your chest. I see that you have a little bit of a rash, but I know that those are normal for you. You've told me before. Everything else looks good. All right, I'm going to go ahead and auscultate your lungs if that's okay. So I'm just gonna have you take a deep breath in and out each time I place this on your chest. Great. Fantastic. I'm gonna go to your back. Fantastic. Sounds good. You having any breathing issues or anything?
No.
Okay, fantastic. I'm gonna go ahead and palpate your chest. Any pain? Any pain?
No.
Any pain there?
No.
Any pain?
No.
Any pain?
No.
Alright, I'm gonna go have you lay down if that's okay with you. I'll pull this up. I'm gonna go ahead and have you lift your head. I'm gonna assess for JVD. Okay, perfect. And now I'm gonna palpate your aortic, your pulmonic, your tricuspid, and your mitral areas. This is the aortic, pulmonic, tricuspid, and mitral. I'm gonna listen to the same areas. Aortic, pulmonic, tricuspid, and mitral. And now with the bell, aortic, pulmonic, tricuspid, and mitral. I'm going to go ahead and listen to your carotid arteries. Great. And I'm going to go ahead and now listen to your abdominal aorta. Fantastic. All right. And I'm going to go ahead and palpate your pulses. So I'm going to first feel your carotid. Perfect. Your femoral. Perfect. Your popliteal. Dorsal. And then your pedal pulses. Great. Alrighty. So now I'm just going to check your abdomen, make sure there's no obvious distension. Are you having any nausea and vomiting? Okay. I'm going to auscultate your 4 quadrants. Alright. And now I'm going to percuss. Let me know if there's any pain. Any pain? Okay. I'm going to palpate. Let me know if there's pain with this. Any pain? Now I'm going to check for your liver and spleen. Normally I would not feel them. So what I'm going to have you do is exhale out and then inhale in, checking for your liver. Do not feel it. Okay. Exhale out and then inhale. Cannot feel your spleen either. That's great. All right. So now for your musculoskeletal, I'm going to just kind of move your arms around, doing range of motion, lifting up. Okay, great. Move your arm up. popped. All right. And just kind of keep your legs relaxed. Great. Move your knee up. Really back up. Okay. And move your foot. Okay. All right. I'm just gonna have you. Can you push down on my hand? Great. Back up. Great. Push down. Great. Back up. Great. All right. So now I can go ahead and have you stand. So you can go ahead and stand up for me. I'm gonna have you move from side to side. Okay. Touch your toes. And then when you stand back up, arch back up real good. Perfect. All right. I'm gonna have you put your arms on your chest. Close your eyes. We're gonna stand here for 10 seconds. Make sure you're not swaying. Perfect. I'm gonna have you put your arms out, palms up. Close your eyes. Stand here for 10 seconds. Make sure there's no swaying. Perfect. All right. So now I'm gonna go ahead and have you just walk towards that chair. And then on your way back, please walk on your tippy toes. Great. And then on your way back again, let's walk on your heels. Good job. And then one more time, come back to me, walking heels toe. Right, perfect, great job. All right, so now you can go ahead and sit back down. And I'm gonna go ahead and have you squeeze my fingers. Right, good job. And then try to pull away. Great. All right, now I'm gonna have you push your arms up like this. And I'm gonna have you try to push. Okay, pull. Great, okay. I'm gonna have you try to push up on my hands. Great. Okay, try to push back on my hands. And then push forward. Awesome. All right, so now I'm gonna go ahead and check your reflexes. Okay, I'm gonna first check your biceps. Your triceps. Your brachioradialis. Your patellar. And your Achilles. Okay, and then you're gonna tell me if you can feel this. Feel it? On this side too? Yep. Okay. And now I'm going to have you, I'm going to hold my finger out like this, and I'm going to have you take your right hand and take your finger to my finger and then to your nose. Okay? Great. Okay, now your other hand. All right. Great. And now I'm going to have you close your eyes. I'm going to move your fingers and toes up or down. You tell me what I'm doing, right?
Up, down, down, up,
Yes.
up, down,
Yes.
down, up.
Yes. Great job. All right, so now, last thing, I'm going to have you close your eyes and tell me if you can feel this vibration on your hands and feet.
Yes. Yes. Yes.
Great. All right, that concludes our exam. Is there any other questions or concerns you have at this time?
No.
All right, thank you for coming in.
Thank you.